are you guys considering requiring people to wear face masks if they do go out in public? Other cities and states have implemented that, and I was wondering if that's something you guys have considered, will consider moving forward, or will that depend on the case numbers?
I'd like to ask the chairman of the Missoula City County Health Board, Ross Miller, to answer that, because the board did deliberate and issue a recommendation a couple of weeks ago.
Thanks, Ellen. Yeah, this is Ross Miller. Yeah, the Board of Health deliberated this issue just last week, and we issued I think the way we phrased it was a strong recommendation for workers of essential businesses that are in contact with the public, and the public when they are in situations where they can't social distance to wear face masks. It hasn't elevated to an order yet. The way we phrased that Board of Health recommendation was that our hopes were that we wouldn't have to issue such an order, but we are keeping an eye on it. Basically, our goal is to try to normalize face mask or face covering wearing. So I think we're gonna basically monitor the situation and see what to do about it. I think you raise up a really good point. I think it's something the community should be very attentive to in reopening. That I think it's something we need to keep a very close eye on. And I don't think we see a reticence to issue such an order or to encourage such an order if we feel the need to. So, thank you.
I've got Marixa.
There we go. I just wanted to kind of clarify in the first part of this order, events and gatherings limited to 25 people. I know it mentions markets, so should we assume that the May 2nd opening of our markets is postponed until now, or is there going to be some kind of capacity there?
Well, it does include the farmers market. So the way they have operated in the past, where it's basically an event and people come to it, could not occur. I am aware, but can't speak for some of the work that they're doing to try to make fruits and vegetables available by other means. And I know I have also talked with Commissioner Josh Slotnick, and of course his background in all of that. I would defer to him, but we do believe there's ways to do that. We also believe that to be safe in this careful opening of phase 1, that the 25-person limit needed to be in place. So that does include farmers markets.
If I could just add a response to that, we do know that businesses and other people like farmers markets are going to have some questions about how this affects them directly. And so I just want to let people know that our environmental health staff are going to be here for a couple of extra hours this evening and part of the day tomorrow, I believe from 8 to 2 tomorrow. And people can call 258-4755 and talk to someone in our environmental health staff that can help them figure out how this is going to directly impact their own business or things like farmers markets.
Thank you, Cindy. Connor, can you hear me?
Yep, I can. Thanks, Mayor. So Ellen said more stringent requirements. Do you believe that the ones that the governor has are too light?
Well, the governors are for the whole state. And so to give another level of protection to the state's largest, second largest populated counties, and to allow the preparation you've heard us discussing, and to have the testing, contact tracing capacity that this large county needs, we do need to add more requirements. The governor's requirements may be a perfect fit for other counties. Small counties may find them too steep. But for this county, in our situation, have determined to add more requirements and time for preparation.
Can I follow up with something?
Sure.
That seemed to be the governor's goal, was to kind of leave it up to the individual counties. Did you agree with that then? Is that helpful to you guys here in Missoula County?
I don't know if it's a matter of agreeing or just looking at what the current data shows, understanding that he's doing that statewide, and that our county, for all the reasons I've given, actually repeatedly, is probably going to need the highest level of protection.
Patrick.
Thanks. I have two questions. Number one, will places of worship be allowed to open on Sunday as spelled out in the governor's order, provided that they maintain the various social distancing requirements?
So I didn't add any additional requirements in the local order, and so then places of worship are guided by the governor's directive.
Okay. And then my second question, do any of you have any update on the Missoula Marathon?
I do not.
Okay. Martin.
Yes, good afternoon. How do you justify keeping portions of Missoula closed when Yellowstone County, a much more larger and equally urban county, is going to follow the governor's directives? Aren't you concerned that might put our businesses at an economic disadvantage when the rest of the state's going to be opening?
Do I have a concern about economic disadvantage? My concern about economic disadvantage would be to do something that will lead to reshuttering businesses. So that is my concern.
And a follow-up question, the governor's recommendations yesterday gave no timeline for phase 2. Several businesses on your ordinance will remain closed until phase 2 is issued. That could be indefinite period of time. Nobody knows. How is that? I mean, what would you tell them saying that there's no definitive timeline to allow you to reopen?
So to quote Dr. Fauci, the virus sets the timeline. So what the criteria are in both the Opening of America plan and the state plan, and as I mentioned in our preface here of whereases, is you look at the epidemiological data and you look at how transmission exists, how it's changing, and how that affects our local capacity. And you can only do that if you have robust testing. So I think Cindy could probably speak to the fact that we are just beginning to test the population in our community. I mean, would you want to speak to that, Cindy, about the priority 3 testing?
Yeah, so what Ellen is trying to talk about is that just last week on Tuesday is when we were actually able to open up our testing to people who do not fit into a high-risk category and are not working in a high-risk setting. So we have barely started really testing members of our population that fit into those categories. So what that tells me is that there are probably a lot of people out in the Missoula communities that were not able to get tested up until a week ago. And so that means that we are still doing case finding in our communities. And as we start to open things back up, it is quite possible that we could see a spike in cases because we do know it's in our community. We haven't had the testing capacity that we really need in order to know exactly how much we have in our community. And so as we move forward, and as I said before, we're also having still having some struggles getting the testing supplies that we need and knowing when we're going to be able to replenish those testing supplies. And so what that tells us is that, we really need to be very careful moving forward, because the more cases that we see, that means that likely that's more testing that's going to need to be done. And at this point, we've barely hit the tip of the iceberg as far as testing in our community.
Last question to follow up on that. Tester and Danes this week said Montana got $5 million for testing and contact tracing. Has that not made any difference in Missoula County to increase testing?
So Martin, I will tell you that we are agitating daily with the state. Testing is a huge concern for the leadership team, and so we've been advocating every day to try to get more tests because that is the way that we ensure safety. We've been trying to track down 500 spots that were allocated to Missoula County for the last couple of days. While we hear about testing supplies being available at the federal and state level, we're having challenges finding them here on the ground with work. So we'll continue that agitation.
Thank you.
Mr. Mayor, could I add something to Martin's question?
Yes, please.
So Martin, I would just encourage you to flip your question around, and how could Yellowstone County keep things open and take this risk when Missoula County has gone otherwise? I think that question is just as valid.
Additional questions out there, Connor?
Yeah, so we mentioned Yellowstone County, and then I'm kind of including Cascade County into this too. They're both also medical hubs for Montana. That seemed to be a big deal for Ellen when she was talking about why Missoula is doing what we do. Are you talking with those areas then and consulting with them too, or are we just taking our own direction?
So I consult with the large counties, so the 7 largest counties' health officers. We actually have a professional organization called the Association of Montana Public Health Officers, called AMPHO, and we have a large, before we had our first cases. However, the public health system by statute and design in Montana is a decentralized system. It is not a centralized system. So wherever we can be consistent and it makes sense for our community, so you might recall it was the large counties that first put some closure orders out. So most of us had 2 kind of stair-stepping closure orders before the governors and then before the stay-at-home. And then we each look at our county. We've all had a lot of different rates. And then we decide, based on what the governor puts out for stair-stepping down, do we need to step down more carefully? And that's really all it is that matter of degree.
Further questions?
I have some business questions if I can toss those in.
Sure, Connor.
So this is kind of for either Grant. Have businesses been consulted on if they can continue making money with all the requirements put on them?
So, Connor, I think what we've tried to do is have businesses at the table right now to talk about what they're feeling in terms of strain and pressure. These directives have just come out. I know that a lot of businesses have reached out to us to ask for clarity on how to do things. I think what businesses perceive as an equal risk to more stringent guidelines right now is a lack of clarity on how to move forward. So I think that Ellen's done a really good job of providing that really tough balance of getting the health considerations right with respecting the needs of our business community to have that kind of clarity and balance their economic needs.
I'm sorry, Samantha?
Maybe, if I could, Mayor, if Ellen wanted to add anything, I think, Ellen, you have specifically talked to individual businesses, so if you wanted to talk about that.
Yeah, we did do some reaching out. Again, it was very short. We got the guidance the same time the public did and the business did. But we had already, through our environmental folks, reach out to particularly the businesses we're most familiar with. But aside from that, we received, both through my email, both through our call center, the county and city, you can write a contact. In the last day, the strong majority of messages that we have received have been for going more gradually and more clearly. I already was looking at doing that and thinking it might be more difficult in terms of garnering the majority's population to do it, but messages have come in, we want to go more gradually, more carefully. We want to cooperate, but we don't know how to cooperate. Now, I can't say that's everybody, but those are the people that reach out to us in the hundreds.
Thank you, Ellen. Other press questions this afternoon? All right, a couple of quick notes. One is I appreciate the recommendation that Dr. Watson will provide to the school board. City of Missoula supports that recommendation. We believe there are way too many moving parts here for schools to reopen safely. We continue to support health department and these orders, but there is a ton of information available to you all beyond this press conference. And Cindy can reel off all of those by rote. If you have additional specific questions, those folks in environmental health and the health department are going to continue to be available to you. Certainly reach out to our offices as well at the city and county if we can be helpful. But there are all sorts of resources at 258-INFO. And Cindy, any other places you want to point people?
Yeah, I would direct people to our website at missoula.co/cvirus. That is where the actual health officer order will be posted along with the appendix. And we do have additional guidance there. And as Mayor Engen just pointed out, we do have environmental health staff available a little later in the evening tonight than we usually do, and also part of the day tomorrow to help answer questions for businesses or people that want to know how this impacts them. And that's at 258-4755.
Thank you, Cindy.
You can also follow us on Facebook under the Missoula City County Health Department, and we will be posting more information there as well.
Thank you. Leadership team, anything else for the good of the order as we approach the top of the hour?
I think Evelyn has a question.
Evelyn?
I'm not pressed core, so I don't know if I'm allowed to ask a question. It's okay.
Well, we've got 78 people on the call, so as long as not everyone asks a question, we could probably handle it. We may have to have a town hall or pursue some other options, but go ahead, Evelyn.
Okay, thank you so much. First of all, I want to thank the city for taking a conservative approach. I very much appreciate that, and I think that's warranted with what we're seeing from COVID-19. I'm not an epidemiologist, though, and will happily admit that. But the thing I wanted to ask was, we're seeing this virus have a asymmetric effect on certain demographics in our community, namely people of color and lower income people as well. This virus is not the great equalizer that it has been touted to be in certain situations. What are we doing? Of course, we need to first protect our first responders and medical personnel that are in high contact with dangerous viral particles, but what are we doing to also protect some of our most vulnerable populations? Are we simply doing cloth masks? And if so, do we have specifications to ensure that those are actually providing reliable means of protection?
So Adrian Beck may want to take a run at that, Evelyn. So we have our COAD task force is working pretty relentlessly on those issues. And I don't disagree. There are people at an enormous disadvantage every day in our society. And this illness is cruel, and they are at greater risk. So that COAD group, I think, continues to work particularly among folks who are unsheltered. As you know, through considerable controversy, we ensured through the Missoula City Council and working with our partners last week that we had a place for people who are unsheltered to safely quarantine and isolate and be cared for outside of the hospital setting if they don't require it. And that was a big step, I think, in the right direction, but we certainly have more work to do. And I'm happy to have any of the other professionals weigh in.
Well, we also have Partnership Health Center, sees people on a sliding scale, and that means, and no one gets turned away for this type of care. Our testing clinic is operating through generous donations from numerous local entities, both hospitals, Rocky Mountain Lab. We don't charge for those tests. We want those. We want to do more of that testing and find out you know, really what does the infection level look like in the community?
Okay, and with that, ladies and gentlemen, we are at the top of the hour. I want to thank you all very much. Thank you for the community leaders who are available and here today. Thank you all for participating, members of the press, members of the community. We are going to keep plugging away here, slowly, cautiously, systematically, but we will be the better for it. Again, you have lots of contact information and opportunity to review these materials and ask questions. So thank you all very much. If weekends even matter anymore, I hope you all have a good one. Stay safe, and it's still okay to stay home. Thank you very much.
Thank you.
Thank you all.